There's no screening test for ovarian cancer. One of the best tools we have now are the pelvic ultrasound and the C125. But again, those still aren't good enough to be able to pick up all cancers of the ovary. For women who are at very high risk, sometimes we'll offer them a risk-reducing bilateral salpingo-oophorectomy. And in today's video, we'll talk about exactly who benefits from a risk-reducing bilateral salpingo-oophorectomy and exactly what is it. So if that sounds good to you, please continue watching. All right, well, welcome back to my channel. My name's Nefertiti duPont. I'm a board-certified gynecologic oncologist, and today I'm going to talk about the risk-reducing bilateral salpingo-oophorectomy. If you're new to my channel, you haven't yet subscribed, please click the link below, and we'll get started. Well, risk-reducing BSO, all that is removing the ovaries and fallopian tubes in someone who's at very high risk for ovarian cancer. I love this uterus, it's so cute. So there are some conditions where a patient's risk of cancer is so high, talk to them about having risk-reducing surgery. So the risk-reducing bilateral salpingo-oophorectomy, again, is to remove the tube and ovary. Usually we cut it here at the cornua and we send it to the pathologist. So we'll cut these two away. And in some women, we'll remove the whole uterus. The risk-reducing BSO typically is just to remove the tubes and ovaries. So who are patients that qualify for risk-reducing BSO? A lot of times I'll have patients who have a BRCA1 or BRCA2 gene mutation. For those women who have completed childbearing, risk-reducing BSO is an option. Now, not everybody chooses to go that route, or some women delay it until they're ready. The other concern is about if we remove the tubes and ovaries, then you're going to go into surgical menopause, and that happens right away. So for some women, we kind of have a shared decision-making process where we kind of talk about when the best time for them to have the surgery is. But having the risk-reducing salpingo-oophorectomy, I know it's kind of a mouthful, does reduce the risk of cancer by 96%. Now, it's not 100% because there's still a 3 to 4% risk of something called primary peritoneal cancer. And when we think about ovarian cancer, really it's a collection of 3 different cancers. There's fallopian tube cancer, there's ovarian cancer, and then there's primary peritoneal, which is cancer of the lining. They're all treated the same, and we kind of lump them together in the category of ovarian cancer, but really they're 3 separate cancers depending on where the cancer started. So patients with BRCA mutations are one of the most common patients that I see in my practice on a day-to-day basis where I'm talking about risk-reducing BSO. The other patients are Lynch syndrome patients, patients with a very high risk for colon cancer. Sometimes they'll be at high risk for ovarian cancer. There are some other gene mutations that put you at high risk for ovarian cancer that may not be associated with BRCA1 or BRCA2. And then there's some patients that have a very strong family history. Like I've had patients where, their grandmother had ovarian cancer, they had an aunt with ovarian cancer, they had a mother with ovarian cancer. And while we may not have identified the gene mutation in that family, those patients are extremely high risk. And so for them, I will offer them a risk-reducing BSO or risk-reducing bilateral salpingo-oophorectomy. And typically for patients that are having that surgery, I do also do an ultrasound and a C125 ahead of time because there's about a 10% risk of having an occult cancer prior to surgery. So I've never had that happen, thank goodness, but there have been reports of at the time of a risk-reducing surgery, a cancer being found at that time. So I typically will do an ultrasound and a C125 ahead of time. So who should do the surgery? So if you've decided to have a risk-reducing bilateral salpingo-oophorectomy, and that's only for women who are at the very highest risk for ovarian cancer, you should see your healthcare provider and talk with them about your concerns. I prefer patients to see a gynecologic oncologist. Now, that's a specialist who specializes in ovarian cancer surgery. But I know, we're not always in all areas, and, we're specialists. So sometimes, patients may not have access to us. If you have a gynecologist who is very capable of doing the surgery, and, that's definitely acceptable. I do personally prefer a G1 oncologist if possible, but I know that's not possible for everyone. So definitely a good GYN doctor. And one of the most important things is the technique, how the procedure is done. So we want to make sure that the tube and ovary is removed completely in entirety. Most of us will send pelvic washings where we'll put some saline in the abdomen just to make sure there's no laparoscopic, but microscopic abnormalities that could be picked up. And we also kind of look at all the peritoneal surfaces. I'll look underneath the uterus, I'll look on the lining above the liver, and just make sure there's no occult or hidden cancer. So I recommend a gynecologic oncologist, but if you don't have one in your area, or if you have a good GYN doctor that's comfortable doing the surgery, then that's who you should see for consultation. The other thing that's very important about this particular surgery is how the specimen's processed. So a pathologist should have expertise in GYN pathology and should understand that the entire fallopian tube and ovary needs to be evaluated, and it has to be cut in a very particular way so that the entire tube and ovary is evaluated for cancer or kind of precancer conditions. So those are kind of things that a GYN oncologist will already know to do, and will talk to their pathologist. So it's something to just keep in mind, that if you are at risk for one of these cancer syndromes and you're thinking about having a risk reducing surgery, definitely see a specialist who is comfortable treating you for that condition. Well, today we've talked about what the risk reducing bilateral oophorectomy is, who needs it, who should do it, and why it's done. If you are at high risk for ovarian cancer, if you have a strong family history, definitely talk to your healthcare provider and just let them know your concerns, and let them know that you're thinking about having risk-reducing surgery, because it's one of the best ways we can prevent ovarian cancer. Well, thank you for watching to the very end. And if you haven't subscribed already, please click the subscribe button below, and I'll see you next time. Bye-bye.